These are the 10 questions I'm asked most frequently about hypnosis. Number 1, will I still be in control of myself? This is often what scares people the most. They're terrified that if they really submit to the relaxation of hypnosis and go fully into trance, they will no longer be in control of themselves. Now this stems from the popular image of hypnosis and the perception that the hypnotherapist does something to you, when in reality hypnotic states of trance is a naturally occurring phenomenon that a skilled therapist can evoke, so you're actually doing it all to yourself. Be assured that you're fully in control of yourself at all times when you hypnotise. You're still conscious, but your conscious mind is given tasks to occupy itself, allowing the therapist to talk with your subconscious mind that already knows how to heal you. No one can take away control of you and make you do stupid things while you're hypnotised unless you allow it. Number 2. Am I surrendering my free will if I get hypnotised? Now, despite what you've seen in the movies, hypnosis doesn't make you the slave of the person hypnotising you. Remember, trance, which is the heart of hypnotic experience, is a naturally occurring phenomenon we all experience every day. Ever read a book and lost track of time? Or jumped in your car to arrive at your destination with no memory of how you got there? These are both everyday examples of naturally occurring trance. I can give you many more. When you are in this hypnotic state, you're actually more aware and focused than you are in normal states of consciousness. The person hypnotising you also can't make you fall in or out of love with someone else, make you change any essential part of who you are, or do anything that you don't want to do. You are in full possession of all of your faculties throughout the hypnosis session, and you're not under a spell, or in any way under the direction of someone else. The things that you've seen in movies or in stage shows where people get hypnotised and run around acting like chickens or saying silly words on command is not real hypnosis. You will never do anything while you're under hypnosis that you would not normally do under everyday circumstances. 3. Can I be hypnotised without my consent? Another area of concern for a lot of people that don't know a lot about hypnosis is, can you hypnotise someone without their consent? The good news is this is 100%, you cannot be hypnotised against your will. If you don't want to be hypnotised, you won't enter a hypnotic state. The process of entering a hypnotic state takes some time because it will take time for your body and mind to reach the state that is necessary for hypnosis. You can stop the hypnosis session at any time during the process, if you're not comfortable or if you don't want to be hypnotised. You've probably seen hypnosis done on movies or on TVs where the person doing the hypnotising snaps their fingers and the other person falls immediately into a trance and is incapable of doing anything. That's not how hypnosis works. Number 4. What happens if I can't come out of hypnosis? This is an easy one. It's physically impossible for that to happen because you're not unconscious at any time during hypnosis. You'll be in a different state, but fully conscious, and you can come out of that state at any time you choose. You can also come out of that state when given a verbal cue by the hypnotherapist. Sometimes when you get the verbal cue to come out of your hypnosis, you may not want to because you're experiencing something that feels so good. When that happens, it may take you a few minutes to return to your normal awareness, but that is only because you want to stay to continue to enjoy the experience, not because you're being forced to stay. You're always in control, even when you're in a deep hypnotic state. Number 5. Can I hypnotise myself? You absolutely can hypnotise yourself. You will need to learn the proper way to do it, but once you've had some instructions, it's very possible to hypnotise yourself. Some people prefer self-hypnosis because they don't trust another person to hypnotise them, and they can't relax enough to get into a true hypnotic state when someone else is around. You can also hypnotise yourself between sessions with a hypnotherapist if you feel you need a little extra relaxation. When you're using self-hypnosis, though, you aren't getting the expertise and therapeutic help that you would get from a trained therapist. So if you're using hypnosis to help you deal with anxiety, depression, or psychological issues in general, then you probably would benefit from seeing a professional therapist instead of relying on self-hypnosis. Number 6. Does hypnosis work on children? Yes, hypnotherapy is often used to treat children that have behavioural disorders and children that have traumatic events happen to them. Children have also been put into hypnotic states in order to help the police. Some hypnotherapists have also found using hypnosis as a method of treating night terrors for children under the age of 10. The logic there is that if we put them into a deep hypnotic state before bed, this relaxes their brain enough that they don't have the night terrors in the first place. If your child is having night terrors and has not responded well to other treatments, using hypnosis is an option. You should discuss this with your GP. 7. Is hypnosis just new age rubbish? Lots of people are skeptical about hypnosis at first, but usually that's because they don't have a good understanding of how hypnosis is used for medical and psychological treatments. Hypnosis is not some crazy new age therapy. It's a legitimate therapeutic technique that's been used with proven success to treat medical and psychological disorders in millions of people around the world. Anyone can be treated with hypnosis, and in most cases, hypnosis is a very effective form of treatment for many different disorders. Hypnosis has a long history of being used to treat illness. It's not a new or untested therapy. Number 8. How many problems can I deal with at once using hypnosis? Hypnosis isn't a magic cure that will get rid of all of your problems at once. You will still need to address your medical and psychological problems one at a time, and over the course of several treatments, and this enables us to see results. Now, it's possible that symptoms of one disorder that mimic symptoms of another disorder might go away with the symptoms of the first disorder, but in general, you will need to tackle one problem at a time when you're using hypnosis as a treatment. 9. Do I need to see a clinical hypnotherapist more than once? Yes, you will normally need more than one session with a hypnotherapist to solve your problem. Most people will see notable results after just a few sessions, so you might not need extensive hypnosis or months of treatments in order to eliminate your problem, but it will almost always take more than one session for you to see any kind of noticeable results. 10. Is hypnosis safe? Hypnosis is perfectly safe. You're always in control of the situation and you're never unconscious. Unlike drug therapies, hypnosis has no possible side effects, and in most people, hypnosis always works. Unlike drugs, which may work or may not work depending on your body's chemistry and what the disorder is. Hypnosis can safely treat the physical and mental aspects of common problems, like addiction, and can help you break your physical and emotional dependency on overeating, smoking, drinking, drama, anger, or any other destructive addiction that you might have.